Greetings. I'm Dr. Denise Elser, a urogynecologist practicing in the Chicago area at the Women's Health Institute of Illinois. I'd like to present on behalf of my colleagues, whose names you can see here. We'd like to thank the ICS for the opportunity to share our abstract. Our topic is Emerging Non-Surgical Wearable Neuromodulation System Shows Strong Patient Satisfaction, Likelihood to Use, and Compliance in Clinical Study. Overactive bladder, which includes urgency, frequency, nocturia, and urgent continence, has a negative effect on quality of life. While there are treatment options available, they each have their own drawbacks. In this abstract, I'll be touching on the tolerability, usability, and satisfaction with a novel, needleless, wearable, home-based system. This was a prospective open-label study used to assess tolerability, usability, and satisfaction with the Avation medical wearable neuromodulation system for OAB. Patients, after signing informed consent, were asked to demonstrate the severity of OAB using a 3-day diary, and then they were fitted with the device, and we made sure that EMG signals could be recorded with the system. The patented custom-fitted garment embedded with electrodes was used both to stimulate the tibial nerve and to record EMG signals from the sole of the foot. Using an app, the clinician set the therapy parameters for each patient, and then the patient was sent home with a control system so that they could use an app on a tablet. Enrolled subjects were instructed to use the system in their homes for 30 minutes, 3 days a week, for 12 weeks. They completed questionnaires that assessed tolerability, usability, and satisfaction, as well as effect on their OAB. In this study, there were 21 subjects, and 1 of those was male. 18 of those completed 12 weeks of therapy. Of the 3 who dropped out, reasons were that 1 was for scheduling conflicts, 1 had foot pain, and the other had device issues. The mean age was 62. Mean duration of OAB symptoms was 8.5 years. And the most common words that our patients used to describe their stimulation sessions were smooth, tingling, and comfortable. Most of them administered the therapy while sitting, some while watching TV. All subjects were compliant with the therapy and treatment schedule. Quality of life improved from average of 40 to 60%, and symptom severity decreased on an average from 60 to 40% as measured by the OABQ. There were no serious adverse events. We asked the patients how easy or difficult the device was to use on this 5-point scale, and you can see that over 90%, almost 95% rated it as easy or very easy to use. We also had them rate their satisfaction with the therapy on a 5-point scale, and 68% were satisfied, somewhat or very satisfied, and there were 11% dissatisfied with results. Concerning the likelihood to use the device in the future, 72% were likely or very likely to use this home-based needleless system in the future. In conclusion, this home-based, needleless, wearable system used to treat OAB was well tolerated. Patients were satisfied and compliant with the treatment protocol, and a majority indicated they would use this device in the future. Additional research is required to look at the therapeutic effects, outcomes, and long-term compliance. Thank you for listening to our presentation.